Hi, I'm Lee Kirksey. I'm a vascular surgeon at the Cleveland Clinic. Sometimes one of the most important things that we can do for patients is to arm them with the information so that they can make a self-adjusted risk assessment of whether they have peripheral artery disease or coronary artery disease. Peripheral artery disease is disease of the blood vessels outside the heart. Coronary artery disease is disease of the blood vessels of the heart that increases one's risk of having a heart attack. So PAD, coronary artery disease, increase one's risk of having a limb loss event, of having walking disability due to peripheral arterial disease, of having a coronary artery disease, a heart attack, or even having a stroke. All of these are conditions of atherosclerosis that builds up within the arteries. That's fat, cholesterol, that builds up within the artery. So arming patients with the ability to assess their risk is very important. So what's the number one risk for developing CAD or PAD? The number one risk is, have you ever smoked? Are you a current or are you a former smoker? This increases your risk of developing these atherosclerotic disease states at least 2 to 3 times greater than someone that has not smoked. Are you now or currently a diabetic? Right? And so that doesn't necessarily mean that someone's on insulin, but are you a diabetic that's on an oral agent? Have you been told that you're a pre-diabetic? Are you on insulin? Being a diabetic and smoking together are the two highest risk factors for peripheral artery disease. And when we look at patients who are at greatest risk of having a limb amputation or a toe amputation or some type of major lower extremity vascular event, those patients are smokers, former or current smokers, or they are diabetic. Uh, Thirdly, when we think about the conditions that one's had in the past, have you had a heart attack or have you had a stroke? That increases your risk of having a lower extremity event. And when we know, when we identify lower extremity peripheral artery disease, we know that that sometimes drives the diagnoses of coronary artery disease. And so that's very important. Do we know the very important risk factors outside of having smoking and diabetic history? Uh, do you know your LDL, your low density cholesterol, your lousy cholesterol, LDL? Very important to know. Typically, an abnormal LDL is somewhere above 130. However, if someone's had a heart attack, a stroke, or if they're diagnosed with PAD, their LDL should be less than